Preventing high blood pressure should be as easy as keeping in good physical health, but surprisingly, many of the ways to prevent high blood pressure involve the same practices of staying in good physical health. These habits should come naturally, but unfortunately, sometimes they don't. Here are 3 surprising ways that high blood pressure and good physical health are linked and steps you can take to help keep your blood pressure down, no matter what your current level of fitness may be. The differences between hypertension and other types of high blood pressure. Hypertension occurs when your blood pressure stays elevated for extended periods of time. Your body needs a certain amount of force to push blood through your arteries, but if it tries to pump too much at once, it can cause damage over time. High blood pressure is one of America's biggest public health problems. Nearly 1 in 3 American adults suffers from hypertension, which increases their risk for heart disease and stroke. To treat high blood pressure, doctors first work to lower patients' blood pressure levels by prescribing medications and lifestyle changes like eating a diet rich in fruits and vegetables. If high blood pressure symptoms become severe enough that medication doesn't help reduce them, doctors recommend surgery. Hypertension risk factors. Research suggests that a handful of factors, including high blood pressure, can predispose you to cardiovascular disease, or CVD. Because high blood pressure puts stress on your arteries, it's a major risk factor for many types of heart disease. Moreover, if untreated, hypertension can also lead to kidney damage, stroke, vision loss, and impotence. Luckily, there are multiple ways to control high blood pressure before it becomes a serious health issue. Keep reading to learn how to prevent clogged arteries by controlling your BP. Lifestyle changes that decrease your hypertension risk. You may be surprised to learn just how many of your daily habits have an impact on your heart health. For example, keeping blood vessels healthy, as well as lowering your chances of experiencing clogged arteries, is as simple as adding a few vegetables to each meal. Healthy foods like kale, spinach, carrots, peppers, tomatoes, and mushrooms all provide nutrients that boost circulation while removing plaque buildup in arteries. If you're looking for one of the best natural remedies for high blood pressure, opt for red wine. The resveratrol in red wine can decrease high blood pressure naturally. The resveratrol activates nitric oxide production in your body, which relaxes blood vessels. Try drinking 1 cup a day to get started. What you need to know about hypertension medications. While many people think that blood pressure medicines are always a last resort, taking them can be beneficial for some. This is especially true if you have high blood pressure but also suffer from heart disease or chronic kidney disease. There are 3 main types of blood pressure medicines: calcium channel blockers, angiotensin converting enzyme, ACE inhibitors, and angiotensin receptor blockers, ARBs. They work in different ways to lower your blood pressure by slowing down or preventing your heart rate from increasing too much when it needs to contract harder. Common side effects include fatigue, dizziness during movement, coughs, diarrhea or constipation, and changes in taste. How to avoid hypertension while pregnant. While there's no way to avoid high blood pressure altogether, women who are pregnant can significantly lower their risk of developing it by avoiding certain foods. Avoid eating too much sodium or salt while you're pregnant, as high levels of sodium in your bloodstream have been linked to high blood pressure in many studies. Eating at least 2 servings of whole grains a day is also advised, as whole grains contain important nutrients like B vitamins that help lower blood pressure. If you're on any prescription medication for high blood pressure, talk to your doctor about switching medications. Many pregnancy-related medical conditions call for different treatment plans than non-pregnant patients require. Twitter, Pinterest, Quora, Type medium by